Well, this is an ultrasound study of a female pelvis presenting with severe pain in the pelvic region. Now, here you are seeing the uterus in longitudinal section. Measuring 8.2 centimeters by 4.5 centimeters. This is the urinary bladder, as this is the longitudinal section of the uterus. This is the anterior myometrium, the posterior myometrium, this is the cervix. Okay, this is the endometrial canal, and the endometrial canal measures 15.7 millimeters up to 14 is considered to be normal, and you can see there are multiple low-level echoes seen within it along with a dense echogenic area. Though endometrial canal is central and is echo-filled of normal size in longitudinal section. Now, adjacent to the fundus of the uterus, we see a sac shape where we see a cystic area. And this is the uterus in longitudinal section. This is the endometrial canal, the urinary bladder. Now this is a cystic area seen in the region of the right adnexa adjacent to the fundus of the uterus that measures 18.7 millimeters. This is the fundus of the uterus, and this cystic area is very much consistent with an ectopic gestational sac, whereas this fluid posterior to the uterus in the pelvic cavity, this black area linear in longitudinal section is suggestive of fluid in the pelvic cavity, whereas this thin-walled cystic area is suggestive of gestational sac if the beta hCG level is raised and if the pregnancy test is positive. Now you see there are in fact two sac-like structures, and she is extremely tender to this area on scanning. Here you see this is a cystic area number 1, and this is a cystic area number 2, and this is the adnexal region with a lot of echoes within filled in this region between these two gestational sacs that are, sorry, I should not say gestational sac yet, and these two cystic areas are 27 millimeter apart, and they measure 16 almost approximately 1.6 centimeters. This is a cystic area embedded in the collection of fluid in the region of the right adnexa. This is all collection, and this is the cystic area, 1.6 millimeter. This is a second cystic area. So two cystic areas seen in the right adnexal region. And if the differential will be that if the pregnancy test is positive and if the beta hCG level is raised, then these two cystic areas are representative of twin pregnancies or two gestational sacs. Here you can see them again. She is extremely tender to this region. Patient is hardly allowing me to place the probe in this region. Now you see, now I am trying to bring the uterus. This is the posterior myometrium in longitudinal section, the fundus of the uterus, part of the anterior myometrium, the endometrial canal, the fluid in the pelvic cavity, and collection in the right adnexa with one cystic area and the second cystic area, two cystic areas, possibly gestational sacs, twins. And when I move the probe towards the left side, I see a whirly appearance, heterogeneous solid mass, which is a fibroid. This is a fibroid, and this fibroid relates to the anterior uterine wall and then extends laterally This is the uterus, and when I move the probe towards the left side, here I can see a pedunculated fibroid, large fibroid. With iliac vessels coursing posterior to it. Now this is an iliac vessel, and this is the fibroid. This is again a fibroid. It's a pedunculated fibroid extending from the uterine fundal region. It relates to the uterine fundus. Let me show you. Here we are. Here. This is the uterus in longitudinal section. This is the uterus. And this is a mass, large mass, which is a fibroid. Worldly appearance. Pedunculated. And measuring, this is the fundus of the uterus. It relates to the fundus of the uterus, and then it measures approximately 15.4 centimeter by 7.5 centimeters. Now this female has given birth to a baby just 3 months back. She has 4 kids. This fibroid has not hindered her previous pregnancies. So this is a case of, to me, this is a case of ruptured ectopic pregnancy because of the fluid. This is the fluid posterior to the uterus, and 2 gestational sacs in the region of the right adnexa. If the pregnancy test is positive, and there appears to be no other reason other than being this is the fibroid, uterine fundal region. This is the fibroid, this is the fundal region of the uterus, pedunculated, and it extends up to the umbilical region. See the appearance of the fibroid. Heterogeneous appearance, no significant calcifications so far. Now this is a case of, this study is a case of ectopic twin pregnancies, ruptured, and you can see small amount of fluid in the Morrison's pouch as well. Here you see, this is the gallbladder and this is the fluid. This is the original gas, and this is the pancreas. This is the superior mesenteric vein, portal vein, and this is the gallbladder, the liver, and this is small amount of fluid that you are seeing in the Morrison's pouch. So all these findings combined together are suggestive of a case of ectopic twin pregnancies, rupture because of the fluid, the bleed you are seeing posterior to the uterus, in transverse section, the cystic area or the gestational sac. Because I do not have the lab profile with me, so by my experience for 19 years performing these scans, I can say with confidence that this is a case of these cystic areas are gestational sacs, two sacs, and this is the fluid in the dependent region peritoneal cavity. This you see this area as this is the urinary bladder, iliac vessels, right iliac vessels, the fluid, the bowels. So this is our case of the day. Thank you.